Alrighty, so we're going to talk around how to locate a radial pulse and also how to take a heart rate, which is a standard practice with every patient that you would do, which is definitely forms part of your primary survey as well. Today we're going to focus on the radial pulse, which is around the wrist area, and the purpose of why we do it and what it is we're actually looking for. So when we're assessing for a pulse, we're looking for the presence of it. We're also assessing the rate, the regularity, and also the strength of the pulse. So there's multiple different things we're actually taking into consideration when we're doing this. As always, we're going to let our patient know exactly what it is we're doing, so they feel comfortable and they're aware of it. Mark, do you mind if I have a feel of your wrist here? We're just going to have a quick feel of your pulse. Is that okay?
Sure.
All right, so we're going to start with the radial pulse. And to locate the radial pulse, it's just below the thumb line, the base of the wrist here, in between the bone and the tendon, on the thumb side of the wrist. How we locate that there, to feel for it using your pointer finger and middle finger. Sometimes you may need a third finger. You're going to press down slightly and gently until you can feel that pulse underneath your fingers. It's really important not to press too hard. If we do press too hard, we can actually occlude that pulse off. So just compressing just slightly until you can actually feel that. And a nice strong radial pulse here. So the strength is quite strong. We're also feeling for the regularity. So is it nice, consistent intervals in between each of that pulse? And then also we're looking for the rate. So feeling that there, and you'll need a watch which has a second hand on it. So we can count it for 15 seconds, multiply it by 4. So just make sure the patient's nice and relaxed, just nice, sit there nice and relaxed. Just keep breathing normally for me there, Mark. I'm going to count this for 15 seconds. So in that 15 seconds, I got a rate of 15. So therefore, we're going to multiply that by 4. So 15 by 4 is sitting at 60 beats per minute. So that's our beats, a heart rate over a minute at 15 seconds. If Mark had an irregular rhythm, what we'll be doing is feeling for that radial pulse there again, but then actually counting it over the whole minute to ensure that we're getting an accurate rate over that minute.